Fat grafting. This is an operation that has been in our armamentarium for many years. There are other plastic surgeons who have had the opportunity to bring it to the mainstream of the treatment of our patients. I have been involved in the injection of fat grafting for about 20 to 25 years. Basically, early in my career, when I saw some Brazilians and Argentinian plastic surgeons who were doing this operation before it became popular in the United States. The fat grafting technique is very surgeon dependent. A lot of surgeons and patients say, I cannot get the results that many preaching to do. And as I mentioned, this is because it's very important, all the steps of harvesting, the way how you separate the elements of the fat, and the way how you inject and which cannulas you harvested with or which cannulas you injected with. And also in which planes you injected, how much you injected. So there's a lot of details that will make this operation a failure or a success, depending how you do it. Routinely, I use fat injection for my facial rejuvenation procedures. I do fat injection for breast augmentation. I use fat injections for the Botox augmentation. I use fat grafting to redo a bad done liposuction that has left the patient with unwanted contour deformities. I use fat grafting for treatment of bad scars. So the applications of fat grafting are multiple. The fat is one of the richest source of stem cells, and the stem cell technology has been in the media in the last few years. We as a plastic surgeon, basically we have been using a stem cell every time we have injected fat grafting. With the studies done, we have recognized that there are some portions of the harvested fat after appropriate treatment that we can separate those stem cells to enrich the injected fat with stem cells. So we call it stem cell enriched fat grafting.